A 45-year-old male present to you with a history of polyuria, polydipsia, paresthesia, and polyphagia. What will be your diagnosis? Pronto. Diabetes mellitus. How you will diagnose this patient?
Sir, we will check the random blood sugar and fasting glucose level.
Which one prefer the most, random or the fasting? Fasting. Other than the random or the fasting?
Oral glucose tolerance test and hemoglobin 1 test.
Hemoglobin A1C test. Which test performed to check the blood glucose level into the last 3 and 4 months?
HbA1.
HbA1c. Which test best perform into check pregnancy? OGTT. And upon the diabetes mellitus, we divide into how many types?
Type 1 and type 2.
Which one is the insulin dependent?
Type 1.
And type 1 diabetes mellitus have which type of the hypersensitivity reaction? Type 4. And which type of the cells will be seen into the type 1 diabetes mellitus?
T lymphocytes.
T lymphocytes. Which type of the antibodies are seen into the type 1 diabetes mellitus?
HLA.
Antibodies.
Anti-decarboxylase.
Anti-decarboxylase antibodies other than the anti-decarboxylase antibodies.
Anti-insulin.
Anti-insulin antibodies. We will see in this patient. And the age of these patients will be less than 30. And if a patient present to you with history of polyuria, polydipsia, polyphagia, and the age is above the 40 years, what will be the diagnosis? Type 2 diabetes mellitus. Upon the biopsy of the type 2 diabetes mellitus, which of the findings will be seen in this patient? MLE protein. If a patient present to you, for example, if a patient who is age around about 20 years, and this patient present to you with a history of abdominal pain, nausea, vomiting, and this patient have the altered state of consciousness, and upon investigation, the blood sugar level is 265 milligram per deciliter. What will be your first diabetes? Diabetes ketoacidosis. Can you tell main important points of the diabetic ketoacidosis?
Blood glucose level is high.
How much?
260 above.
250 above.
250 above.
Okay.
And second one is fruity smell.
Fruity smell is in the symptoms, but we can't say that if a person present to us only for the fruity smell and we say it is a diabetic ketoacidosis. Altered state of consciousness, you can say about the pH. pH will be the acidic and the metabolic acidosis. And what will be the treatment of the diabetic ketoacidosis? Insulin, other than the insulin. Rehydration and the fluid. What will be the level of the potassium in the diabetic ketoacidosis? It will be the low or high?
Sir, it will be low.
It will be low. In the cell or in the blood?
In the cell.
In the cell. And in the blood it will be high. Or the total potassium level will be
Low.
Total potassium level will be low. Why the total potassium level will be low and it is increased into the blood? What is the mechanism?
Because of when insulin decreases,
Yeah.
the potassium came out from the cell, and in plasma it increases, and total potassium is depleted.
What is the mechanism of total potassium depleted?
Because in cell decreases, and in plasma,
Due
urinary
to urinary excretion of the potassium. And for example, if a patient whose age is around about the 50 years and this patient present to us with the history of the epigastric pain and also this symptoms, patients have the altered state of consciousness, and this patient have the blood glucose level is of 560 milligram per deciliter, but the ketones are absent. What will be your diagnosis? HHS. And what will be the treatment of HHS? Same as the type 1 diabetes mellitus. We will give the insulin, fluids, and also the potassium.